Thank you for joining me. I'm Adrian Sipes reporting for The Slate. Some may believe that the media has sensationalized Ebola in the recent weeks. That being said, I sat down with Shippensburg University's medical director Todd Peterson to get some factual information about the disease, as well as the university's plan of action if a disease or epidemic of this nature were ever to make its way to Shippensburg. Let's take a look.
It's an issue that we need to take seriously, but that we also need to take in a rational, calm way, and not overreact, and also put it into perspective, and put it into perspective in comparison to a lot of other problems that we have in the United States, health-related matters that have a far bigger impact and are a far bigger threat than Ebola ever will be.
While Peterson touched base on multiple health-related matters that are gripping the U.S., ones of which that don't get the type of attention from the media that Ebola has received, he did say that the Ebola controversy has previously been discussed in recent weeks with the university leadership.
We discussed our plan, our approach, and we are continuing as this evolves, to develop it.
As of now, Shippensburg University does not have any international travelers that have been to Western Africa within the past 3 weeks, which is the designated time one is monitored for Ebola-like symptoms. But with winter break approaching, the university is monitoring and paying close attention to any individual coming back that could show up as a potential risk.
And we'll evaluate the risk. We have very good guidelines from the CDC on how to evaluate risk based on level of exposure, and then based on that risk, how to monitor that individual, or to what degree would that individual need to be kept away from others, or perhaps kept off the campus. We have answers to those questions, so we are prepared to monitor and deal with anyone who has had exposure and may pose some threat.
Peterson, who acknowledged the criticism the Center for Disease Control has been receiving as of recently, praised the CDC for the stellar job it has been doing in order to combat this disease, but also for the guidelines it has laid down for the University Health Center to follow.
So there's really two parts. One is identifying those who may be at risk for Ebola. And once we identify someone who may be at risk for Ebola, and that would be someone who within the last 21 days has a potential exposure. So currently that would be someone who has been in one of the West Africa countries. And then after we identify may have had exposure, we rate that exposure on various level of risk, from high risk to low risk. And depending on the level of risk, then we determine what sort of monitoring they need.
According to Peterson, that monitoring could be anything from controlled movement, which could restrict the individual from using public transportation and being within 3 feet of another person, to self-monitoring where an individual will evaluate themselves for a 21-day period.
If we have someone that we feel would have potential Ebola because they have fever, temperature 104 or higher, headache, vomiting, diarrhea, bleeding, and they had a potential exposure to Ebola, that is someone we would immediately send to a center that was prepared, ready to deal with them and take care of them. We wouldn't take care of or keep them here. They would go somewhere else immediately. So we would not treat someone that we thought potentially had Ebola.
However, it's not just the Ebola epidemic that has the University Health Center taking precaution. In fact, there is a specific adaptable protocol that was developed a couple years back when the swine flu emerged that the university still uses and is continuing to adapt for future infections and diseases.
We're currently in the process now of updating that protocol for other emerging infections. It's Ebola this year, it'll be another disease next year. It's really kind of hard to keep up with specifically. So we just adapt our plan as we go along to what seems at the time to perhaps be a threat.
Peterson did go on to say that at the moment it is not within the university's mindset to treat an Ebola patient. However, he did say that could change. If somehow a large number of infections do begin to emerge within the area, he said the university is prepared to adapt and train for that situation. But as of now, the university will not be treating any potential Ebola patients with symptoms relevant to the epidemic going on in West Africa. And at the moment, the university does not have any individuals on campus that pose a risk of exposure. Bringing the news to you at Shippensburg University, Adrian Sipes. Thanks for watching.